So welcome everybody. This is a presentation from the Alumni Association from the School of Nursing. And for those of you who may not know too much about it, we've been in existence 20 plus years and sometimes it's very active, sometimes it's not so active, but we're getting more active and we've got some very interested alums who are very interested in being active in this. I myself am an alum. If you don't know me, I'm Dr. Karen Johnson Brennan, and I graduated from San Francisco State back in 1967. Good God. Anyhow, and I've been teaching, I worked in critical care and then for about a decade or so, and then I've been teaching at State since 1978. I'm retired, but I'm still teaching part-time. I'm teaching some of the nursing skills labs at level 3. So I have met some of you, not all of you. Today we're and here's our director, Dr. Marianne Van Dam. Would you like to unmute yourself and say welcome to everybody?
Good morning, everyone. Thanks for being here. It's good to see some of you again. I haven't seen you for a while. You've been hiding. I know you've been hiding. Everybody's been hiding. Anyways, I'm just very happy to have these kind of events, and I just want to make sure that they continue. So please take it away, Dr. JB.
Okay, thank you. So before I move on, let's just go over some Zoom etiquette. Is that I would like, unless you are actively speaking and called on to speak, I would like you all to stay muted. And if you have any questions, there's a thing at the bottom where you can raise your hand to ask a question, or there's the chat room where you could enter in a question to ask that you may want to have answered during the thing or at the end of it. But don't unmute yourself until you're called on. And so you could post questions on chat or raise your hand, but otherwise stay muted until you're called on. We have 3 wonderful speakers today, alums. And so I'll introduce our first speaker, who's pardon me, you're not doctor yet, but you may be someday. Okay, now I've got to put my glasses on to see here. Edison Lungangwa he got his BSN and his MSN. He was in the ELM program and graduated in May of 2018. With a concentration in adult acute and critical care. He's an RN on the med-surg floor at UCSF Parnassus campus, and he's currently working with COVID patients. And he literally just got home a couple of minutes ago from working the night shift. He also works on the med-surg total joint replacement floor at Kaiser Hospital. He also volunteers with AIDS Walk San Francisco, and currently, this is very interesting, partnering with some health providers in Uganda to expand healthcare access by organizing volunteer medical trips from other countries to go provide health services to people in rural areas. I'm imagining, Eddie, that's in Uganda. Is that true? Yeah, that's wonderful. And have you spoken with Dr. Van Dam about her nursing school in Kenya?
Yes, we've always been thinking about it. So
yeah, wonderful. So our faculty, our alums are all very universal and wonderful. So I'm going to just mute myself, and Eddie, if you'd like to just talk to the people about your topic of what's reality like in nursing today.
Thank you so much for that wonderful presentation, and Happy New Year again to all of you. I think I met some of you last year around December when we were planning this, this meeting. And also congratulations to the new grads. I'm glad that you chose nursing, and I should say you chose the best field among all the fields that we have. I think nursing is the most rewarding, and you really make a great impact in the lives of so many people, not just in the United States, but all over the world. And I would be happy to have you join us in Uganda or with Dr. Van Dam in Kenya. So um, I'm glad that we are having this topic because since COVID started last year in February, actually it started before the beginning of last year, but we here in the United States, we got impacted mainly at the beginning of last year. And I should say, unfortunately or fortunately, I ended up being on the front line because uh, when uh, when UCSF was deciding which unit to designate as the main COVID unit, my unit was chosen to become the main COVID unit for the entire UCSF campuses. So that's where I am. So I'm on the front line right from the beginning. And basically the information I'm going to give you is from first experience, and you can decide how you take it. So one of the things I want to talk about is how to respond during the emergency. Because I know when I was in nursing school, we learned that when there is an emergency, let it be code blue, or if you have a patient who is high for risk and then the bed alarm goes off, you have to run in right away to be able to save the patient. But since COVID started, all this has changed. I don't know if all of you remember some news that came out at the beginning of this pandemic. I think one of the patients was COVID, went like into cardiac arrest at one of the hospitals. I don't remember which hospital, but it was in the news. And when the providers ran in to provide care, emergency care at that moment, some of them didn't put on the PPE. And it was so unfortunate that one of the people who responded to that event contracted COVID and ended up dying. So when I was thinking of the things that I should mention, I thought this is something that we should, as new grads, this is something that we should really be mindful about, because when there is an emergency, it's not like you are going to be following like a script. If you've been uh, interacting with many patients, or if you are on the floor, it is just by instinct. You know there is something is happening, you run into the room, and sometimes you forget to put on the appropriate PPE. So on my floor, many times we get confused patients, and these are patients who are at high risk of falling. We always turn on the bed alarms. And if they also COVID patients, so it's so challenging because you cannot always just be sitting outside the room. You also have to take care of other patients. But when the alarm goes off, uh, I don't know other settings, but at UCSF, the doors we have, you can stand, even though the doors close, there's a glass, so you can see the patient. So when the alarm goes off, you stand outside the door, you see the patient literally jumping out of the bed, but there is nothing you can do to stop the patient from jumping out of the bed, because one of the things you have to do is protect yourself. You have to take time to make, sometimes depends how you are used to putting on the PPE. Sometimes it may take a few more seconds than other people. But the point I'm making is you really have to put on the PPE. It doesn't matter if the patient is jumping out of the bed or patient is going into cardiac arrest. You have to protect yourself first before you get into the patient's room. And on building on this point, another point that I want to point out is PPE, the personal protective equipment. I know when we are learning, we always talk about how to promote infection control, and yes, in school we learned that okay, you use, let's say, mask. The moment you get even before you get out of the patient's room, you have to toss the mask. But the reality is we do not have enough PPE right now. I know the situation is getting better, but still things are different from how we learn in school, because I understand at the beginning of the pandemic, we never had access to the N95. I know CDC guidelines were always changing. It's droplet. You are going to be using a surgical mask. yes, like some of us who are on a COVID unit, we decided, you know what? Yes, I know everyone is saying it's droplet, but we don't know. It's a fluid situation. Things are changing. We were always, at least, we always had access to some N95, and we could use it, especially if a patient has been on aerosolizing procedure like nebulizer treatment. But right now we have, I should say, it's the situation is getting better, but still not so good. So if you are lucky and you're working with a COVID patient, you will get N95, but it doesn't mean that the moment you go into the patient's room and then you come out that you have to toss that N95. The reality is you get, for example, like what we are doing, we have a brown bags. So for each patient, you have one N95 for the entire shift. Like for us, we are doing 12-hour shift. So you have to figure out how to really keep that N95 clean. Some of the things that we've come up with is um, when you are taking it off, just make sure you really don't touch the areas that will be getting in close contact with you when you are putting it on next time. And yes, mainly we are recycling the N95 for the entire shift, but things like the gown, N95 and the shield, that one we use for the whole shift. But gowns, yes, we have enough gowns, which is much better than before, because I remember we reached a situation where we had to keep gowns. You don't know if tomorrow you have enough gowns or not. So if you had one and you feel, oh, this gown is not so soiled, you try to save it somewhere just in case tomorrow you don't have enough. But if you come back tomorrow and you have new ones, then you toss the old one you have. So that's one of the reality. And then I don't know where some of you are going to work. The new grads. But if you are going to be working in California, I think most of you may be aware that we have good labor system whereby we have uh, nurse to patient ratio limit. So some hospitals, like for us at UCSF, our ratio is 1:4 on the med-surg, and then med-surg is the highest ratio. And then as you go down to TCU and ICU, the ratio keeps on going low. But in the past, I think 1 or 2 months, I cannot remember exactly, but what's happening, California Department of Public Health is accepting waivers for different hospitals. So you, depending on which hospital you work at, you may find yourself, if you are expecting 1:4, 1:5 patients, you may find yourself having to take up more patients. And this is the reality, because the reason being that we have more patients coming in as compared to the number of providers who can provide care for these patients. And on top of that, the few nurses we have, if they get sick, it may be hard to find someone to replace, and yet we have to provide care to these patients. So that's something you should also expect as you get out in the field. And getting away from like the PPE, I should also diverge down to our calling as nurses as we provide care to the patients. Um, I've had instances where someone is really towards the end of their life, and the families they are calling in because they want to at least be able to talk to their loved ones. So many times you are going to find yourself to be as a bridge between the family, because families are not allowed to come into the hospitals, especially like right now during the surge. So if you work at a hospital where there is enough video, or like we use some video um, capabilities. For example, you have an iPad and then you can provide FaceTime or Zoom meetings with the families. So sometimes because the patient cannot, may be so weak to be able to interact with the family, you may be the one who may have to listen to what the patient is saying, and then you'll be able to convey it through the Zoom to the family. The reason why I'm mentioning this is you may go to the patient's room, the patient has COVID, and they think you are just going to rush in and rush out. But if you think about this patient who may die in the next 1 or 2 hours and you want to say the last few words to the family, you just have to pray that, okay, yes, I'm going to spend a little bit more time with this patient, but at least I want to be able to do what I would like to be done for me in case I was in this patient situation. And then lastly, I should say things have changed how we get jobs. I know, yes, I mentioned about PPE and everything that's going on, but as you go out in the field to search for jobs, you are going to find that hospitals are using different approaches to recruit. So I'm not good at interviewing through through Zoom. I was lucky that all the jobs I got, it was face to face, so it's easier for me to express when I'm seeing someone face to face. But if you have some weakness in that field, I should say you should polish it up. You are lucky that you graduate, especially like during this time. That's when most of the hospitals are opening up the new grad programs. And I should mention that I didn't write it down, but at UCSF, actually, the new grad program, I saw someone posting, I didn't look on the website, but someone was mentioning that the new grad program is already open and it may be closing maybe in the next few days, maybe like January 20 or 22. So just check it out. But the point I'm trying to make is that polish up on how you can create a good impression when you are interviewing virtually with the employers. And I think that's what I wanted to share with you. So I'll be open to any question, and I think that's it. Thank you so much.
Eddie. Yuli, let me just ask a question. Do you want to entertain questions immediately after each speaker pertaining to what they just talked about, or do you want to hold all questions until the other two speakers have completed?
We can hold off the question until after all the other two, Carly and Samantha, speak, and then we can take questions.
Okay, great. Thank you.
Thanks, Karen.
Thank you. And just one thing on the buffing yourself up for doing a good Zoom interview. There are actually, if you go, and you're far better on computers than I am, there are programs, there are little self-help videos and things on how to do a good presentation via Zoom. So those could be helpful. So I guess I'll just go in order here. So our next, Sam, are you ready? Our next speaker will be Samantha Sassy. She has her RN, her BSN, her MSN. She was an ELMA student who graduated very recently in December of 2019. Her master's focus is in public health nursing. She's an RN volunteer with the San Francisco Family Public Health Shelter and Urgent Care. She's performing COVID screenings and clinic triage. She's currently a staff nurse 1 on a very complex GI, liver, and kidney transplant unit at Sutter Health at CPMC, their new campus on Van Ness. And I have the pleasure of having both Eddie and Sam as my students during my career at SF State. So Sam, I'll just let you unmute yourself and you can do your presentation. Thank you.
Great, thank you, Dr. JB, and thanks, Eddie. I think you bring up a lot of really great points, especially about PPE, and I was going to touch on a couple of those myself. So hello, everyone. Happy New Year. As Eddie said, hope everyone is taking care of themselves and that you and your families are staying as safe as you possibly can and as well as you possibly can. This has been quite the year plus now of challenges from all aspects, especially for you guys going through your nursing school programs and having so much change and having to adapt and be flexible, as we know is our mantra at State SON. So appreciate you guys for making it through that. So yeah, I think the thing that I'm most excited about right now is that I've been working doing bedside nursing at CPMC Van Ness campus, and because we are a specialty complex GI and particularly transplant unit, we only get a subset of COVID patients. So I have worked with COVID patients, but they're typically what we call our patients. So patients who have been on our unit or have liver, kidney, pancreas, or other GI problems that are known to us so that they can get specialty care while they're also being treated for COVID. And the kind of focus of what I wanted to share with you guys is being a new grad nurse, you know, as a novice nurse, they tell us I'm fortunate to be in a new grad residency program through Sutter Health. So I'm getting, you know, 9 to 12 months of training and support. And I also got about 10 weeks of orientation with a preceptor on my unit. They consider us to be novice nurses for about 12 to 18 months because that is about the time that it takes to just really understand kind of the scope of the basic nursing practice, see what's happening on the unit, understand the different kind of disease processes that you come across, and to kind of get past the very task-oriented kind of context that we live in as new nurses. It's something you can't escape from. You think, well, I'm great at doing tasks, and then you've got 4 or more patients, some of them complex, some of them not, with lots of things going on. And you really realize that prioritization and being able to focus on that skill and also just having the basics down, especially mechanical basics of tasks, is really important, because when you're doing things like attaching syringes, setting up primary and secondary setups, and putting them in the pump and trying to draw blood or trying to start an IV, that's just one thing by itself. But when you're now working with either COVID patients or patients in isolation, when you have multiple layers of PPE on, you're nervous, you're sweating, your shield is fogging up, your goggles are fogging up, your gown is soaked. It's like, it becomes a lot. And then you're worried about time, and you've been in the room for a long time. And like Eddie was saying, like sometimes you just can't plan those things about how much time you need to spend. So my suggestion, and something that I got from my preceptor, was practice those mechanical skills at home as much as you can. If anyone has any leftovers from their skills lab, or if you can pick up leftovers once you start, my preceptor often gave me, he sent me home with a primary bag, a primary tubing set and secondary tubing set, told me to watch a bunch of videos and to just do it over and over and over again, so that I wasn't so focused on being able to just do that mechanical task that I was missing other things. Because really being able to manage your time appropriately and prioritize things is about building fluidity and building enough efficiency that you can focus more on the patient instead of like, why am I troubleshooting this pump for 15 minutes in the room? So definitely do those things. Practice using both hands. I've had to do things upside down and backwards when the IV is like not inserted in the way that you thought it was, not with your dominant hand. Those things just help like basics, so that as the kind of pressures can build, depending on what your patient assignment is and who you're treating, especially if you might have 3 or 4 COVID patients. And that's when time really gets to be important. And speaking of prioritization, so I talked to a couple of my cohort graduates who are working in different clinical settings. I have someone in the ED at the VA in San Francisco, and someone who actually moved to Washington who's working on a med-surg unit that's primarily COVID. And they both kind of said, it's easy to get overwhelmed as a new grad. I just the large number of tasks that you have to do. Again, thinking of ourselves in this new kind of experience in the first 12 to 18 months. And just really understanding that prioritization, there's, it's, focusing obviously on what needs to be done, making sure your patients are okay first, are they stable, having an overall plan, but then really focusing on one thing at a time. I definitely, kind of hit the almost 7 to 8 month mark now, and I see such a difference in myself in terms of my ability to just stay calm, cool, and collected as the number of tasks increase, and as I have to either don and doff PPE to go into one room and do a bunch of things, and then I've got people calling me. Bed alarms are going off, call lights are going off. We don't have PCAs on the floor. I work the night shift. We're often down to just one PCA for 32 patients, which means I'm doing all of the vitals, all of the, regular care for patients, helping them up to the bathroom, doing cleanups and those kinds of things. So, just figuring out that that one, you can accomplish everything. And the more you just take time and kind of slow down, give yourself grace and give yourself space to work, makes a huge difference in at least for me, my ability to just like move through the shift and be able to really focus on my patients. And especially with COVID patients, I think you put this, really aptly, because we have no access to family really, the patient support systems have really become tenuous, and it's difficult for them. They're alone, they're frustrated, they're scared, as many patients are just, without COVID. And so really just taking time and building in time to connect with them in a way that helps them feel supported and cared for. And at the same time, while you're doing that, you'll be able to, just kind of get that that survey and that assessment of what's going on in the room. With COVID patients, they can decompensate quickly, even on med-surg units. They're high acuity. Is there O2 on? Are there O2 connections like in? Can you find someone who's like desatting and you're like, what is going on? And then you realize, oh, the O2 tubing became disconnected. So just like doing those safety surveys while you're checking in with the patient and kind of taking all that information in. And lastly, I would just add, jumping off of what Eddie was saying about PPE is you have to feel protected. So one of the things I was getting confused about in my first few months there is that we were getting recommendations about, well, if you feel like you need an N95, you can ask for one. But we weren't getting clear guidelines about, what should be done. Like, and I'm a person who I'm like, okay, tell me exactly what I should be wearing at all times. If that, what is the protocol for the unit? And that's changed slightly. We just moved into mandatory face shields in all patient rooms or occlusive eyewear because they're finding that one, transmissions are occurring through mucous membranes of the eyes. And two, that nurse to nurse transmissions are increasing pretty rapid, or exposures are increasing pretty rapidly. When you think about getting or giving report, doing handoffs, getting breaks from people, we're much closer, obviously, than just 6 feet. And so now we're all wearing face shields all the time, pretty much on the unit. Another one of those skills to practice is donning and doffing. Doffing in particular is the point of exposure. Like Eddie was saying, if you have to reuse your N95, you've got one for one whole shift. Really be cognizant and careful We put a surgical mask over our N95s that we remove in the patient room, and then you leave your N95 on. If you're taking a break, you need a sip of water, and carefully removing it and preserving it in whatever way that you can. And then just taking care of yourself, right? I think at the beginning, my first 3 months, I was like so worried about finishing everything on time or being able to do what needed to be done, and also, you know, connect with patients in a way that was meaningful. But I wasn't taking proper breaks. You have to stay hydrated. Even if you've got an N95 on, you're not supposed to break the seal. You know, if you're reusing an N95 anyways, take the time at least once an hour to get something to drink if you can. Stop and go to the bathroom. Give yourself 5 minutes. We cluster our breaks on night shifts, so we don't do the 2 15s and a 30. So you could technically go, you know, 7 hours without stopping, in spite of your break. So I think those would be the biggest things. And then maybe later on we can talk a little bit more about the kind of new job search stuff. But yeah, I'm so happy. I feel so fortunate to have gone through SFSU's School of Nursing program and the experiences I got there. And I feel, you know, you learn as you do. But I feel like I was pretty well prepared, and I'm just really excited to be in the field right now. Thank you.
Thank you so much, Sam. That was wonderful. And it's kind of like, for some of us that have been out of nursing school for a time, it brings back memories of my first job and how absolutely you really, I think I finally began to breathe and feel semi-comfortable. It was like giving birth to a baby. It was at around 9 months. And going back to what Eddie was saying about the nurse staff ratio, I worked nights at Stanford, and we had like a 30 patient ward, but it was all the heart transplants and kidney transplants post-op, but not ICU. They'd come from ICU, but it was still heavy duty. And my God, we had on night shift, we had like 10 patients each, and sometimes no nursing assistant at all. So it's, yeah, organization, prioritization is a key thing to develop. So excellent presentation, Sam. Thank you. So our final speaker is very exciting. Carolisa Laxon. She has actually, you know, I'm looking at all your initials after. And I don't even know what some of them are, but she was an ELM student who graduated from us in May of 2018 from the Family Nurse Practitioner Certificate Program in August 2019. And she's a pediatric nurse in the Med-Surg unit at UC San Francisco Benioff's Children's Hospital. She also works per diem as a nurse practitioner at a private practice urgent care clinic. She also holds a master's degree in public health from Touro University. And she recently returned, we're so happy, last year in 2020 as a clinical instructor for level 1 students. So she can really share with the brand new incoming students what it's really like in the field. So, but I have to ask you, because I don't know what this means. Well, FNP, Family Nurse Practitioner, but then it's -BC. What is it? What is that?
That's the board certification.
Board certificate. Okay, sorry. Shows you
And it's certified by ANCC. If it's AANP, it's just C.
Wonderful. Okay, thank you so much. So I will mute myself now and give you the floor. Thank you.
Okay. Hello, everyone. I'm so happy to be here. I know Dr. Van Dam jokes that they can't get rid of me because I love the School of Nursing so much at SF State, so I have never left. I'm kind of similar to Eddie. We're in the same cohort. And we also started the new grad program at UCSF at the same time. So we started the same, but you'll see my experiences might be a little bit different because he's an adult and I'm a pediatric nurse. And we're not as affected like by COVID as far as seeing COVID patients. I have had patients who, we test them all when they come into the hospital, but and I've had patients come up positive, but we send them to our designated COVID unit. So I would usually transfer them out. So I don't care for the COVID patients, but I think you guys will see that every unit is affected by COVID, even if you're not a COVID designated unit. And because I was a clinical instructor, I want to acknowledge, all of the struggles and the tribulations, the confusion, the anxiety, everything that you students, I'm sure, have had to fight through to get to this point. I know that I've seen the differences from when I was a student. You guys have those mega skills days with multiple checkoffs in the same day, which I never had as a student, and I would still get nervous before my checkoffs, even if it's one checkoff a day. I know about you guys getting shut out of clinical sites and having to switch to online simulations and assignments and worrying about graduating on time, and I saw the behind the scenes of wondering if the BRN was going to grant waivers for those direct patient care hours. And I've experienced, the clinical sites, changing on a dime, and me not being able to tell the students until like day before, like, this is where we're going to be this week. So I know about the students, you guys doing makeup hours in your summer break from last semester while still doing your current semester's clinical hours. So I know you all have had to adapt under a lot of pressure. And I think that's your resilience, what's going to make you guys successful nurses. Because working as a nurse, I'd say in 2020 is a lot like when you guys went through nursing school. There's constant changes. Like Eddie mentioned, the PPE shortages and the types of PPE to use. I've seen us go from, we usually had like paper gowns, and I've seen us go to like plastic, almost raincoats, to now we use cloth gowns that are reused. Like it's one-time use, but we put them in the linens containers so that they get washed and reused. And it's frustrating at times because they're still like tied up, and you're like trying to get in the room fast, like Eddie will mention, and you have to like you can't even put it on properly because it's still knotted from when they didn't unknot it when they're washing it, because I think we are so short-staffed in the hospital. I think also you will notice I've seen policies and workflows, everything from visitors policies changing very, very often. For peds, we get to have one parent at the bedside. For us, a lot of what's changed is the handoff between the patients. Before it was at the bedside, now we've switched to doing it downstairs with security, which I think kind of alarms parents sometimes as well. We've changed to so as part of that, even the elevators now are badged, so it's become more of even like a locked unit feeling. I think the other thing, kind of also what Samantha and Eddie have mentioned, is the Zoom aspect. I feel like you're the eyes and ears. Not only, nurses have always been the eyes and ears for the doctors a lot of time because we spend so much time with the patients, but I feel like I'm the eyes and ears of so many more people because so many people have to work from home now. So for me, it's social workers. I'm setting up Zoom meetings with other family members, since only one parent can be at the bedside. As a pediatric nurse, sometimes I'm also the eyes and ears of our child life specialists, and giving them heads up, like maybe this patient needs a little extra TLC and maybe some playtime with a child life specialist, and even teachers. So we have teachers at our hospital. They usually were on site and now they're not. And so they oftentimes in the morning will check in with me and say, can you actually, you have so many tasks, but they're like, can you go and see if this patient has like school needs and get back to me? And so it's a lot of, I feel like I've had to get better with closed loop communication. And I think, like Samantha said, juggling a lot of tasks and remembering there's so many people that I have to get back to throughout the course of the day. For me in peds, we've admitted a record number of children, adolescents in mental health crisis. So I think there's even more of a mental health aspect to our work, just working during these times. Um, at our unit, something new, all of our PCAs or CNAs, all of our nurses are becoming trained in nonviolent crisis intervention. It's a certification that I guess anybody can take, but they're offering it, they're like mandating an 8-hour class for us to be trained in that, just because we see so many mental health as people in mental health crisis, because their routines have been changed. I see so many adolescent eating disorder patients, patients with on the autism spectrum who, you know, they're at home now, they can't get out, and they just struggle with that, and they actually have to be hospitalized for it, just because their behavior sometimes it's just they're a danger to themselves, unfortunately. So for me, I think specifically um, the pandemic has made me reevaluate my next steps. Um, I think my cohort was kind of unique, where that I was able to go straight into the NP certificate program after I finished in 2018. Um, so I think before COVID, I had planned to kind of jump right into NP practice, but I've stayed at the bedside longer just because I've seen there's a big need, you know, like staffing, kind of similar to Samantha. We have sometimes one PCA for like 8 patients in the daytime, and I often don't even have one. It is just me. Um, for me, I actually so I passed my board certification in December of 2019, took a little break, had my first in-person NP interview in March of 2020. That was in person at SF General, and that was the last and only in-person interview I had. All of them have been through Zoom. I've watched as UCSF was on a hiring freeze, has been on a hiring freeze since last year, all the way up until July of this year. But like Eddie mentioned, I've talked to our nurse educators, and there is a new grad cohort that they're hiring right now to start in April, and they will do another one in October. So that's a change, because we didn't have one last year. They'll do 2 this year. So that's a change. Although technically we're still on a hiring freeze. So that's also kind of, I think, made it more difficult for me as far as like the job hunt. I've actually, so since that I've done 11 Zoom interviews. All Zoom, and I still don't know if I can say I've gotten used to them, but I don't know what the best like tips are for those. But it's been a struggle. Most of those have resulted in I haven't gotten a full-time NP job yet, and so I know that, you know, the fear and the questioning every interview you have, and your ability as ability to be, you know, either a nurse or an NP. But I think it's important to note, like, I think also the new normal in nursing is that we continue on no matter what the setbacks we see, no matter the curveballs they throw at us. I think it's showing up and persevering and doing the best you can despite all the uncertainties that you face each day. I do think it's harder to be a nurse to enter now than when I started, because I'm able to, I think, contrast when I started in 2018 and the changes I see now. I think there's just so much more to learn, so many more policies to keep up with. Even we have a hard time keeping up with. I mean, for us, I'd never done swabs before COVID, and now we do the COVID swabs, and that's changed. Now we also test everybody every 4th day. We test them again on a weekly basis now, and that's the recent change in the last 2 weeks. So I think the thing I just want you guys to know is that everything's constantly changing, and that's the new normal. And we get through it. And I think just being flexible and being able to adapt is going to be the most important thing. So that's what I wanted to say.
Thank you, Carolisa. That was fantastic. It's mind-blowing to hear your stories, actually. I'm getting a little emotional here. I'm going to turn it over to Molly, who's going to be the moderator for the Q&A session to follow here. So for those of you that have questions, and please, Molly will call upon you to answer and ask all the questions you want. I see there's some, at least one person is in the chat room. And if you have questions, enter them into the chat room and or do the raise your hand thing. And I actually have some questions myself, but I'll let the student body be the first. I'm not going to hog this one. So I'm going to turn it over to Molly. Thank you.
Thanks, Dr. JB, and thank you to all of our speakers. I think you guys have provided really great information and a really interesting perspective on what's going on right now. So if anyone has any questions, feel free to raise your hand. You can put it in the chat. Why don't we start off? I know we did get one question in advance, so let me throw that out to you because I know a lot of people here are interested about jobs, new grad, have a lot of anxiety and questions about that. So the question we got in advance was, if you choose a job and you feel like it's not for you, how long do you think it's appropriate to stay in that job before you look for something else? I know it sounds like all of you have stuck with the jobs you originally got, but you have coworkers who've done this, I'm sure. Do you have any advice for somebody who might have concerns about that? Any of you that want to step up? Eddie?
Sorry. So regarding how long you may have to stay in the job before you jump the ship, I should say, I mean, from the nursing perspective, I should say if you are offered a job, you accept that job and you start. At least stay for 6 months, even though you don't like the job. Just do a favor to the employer and start at least a few months, but at least you give an advance notice of you quitting, because some organizations, they are interlinked. And if it's, you never know, you may just quit a job after 1 month from this hospital, and then next thing you know, the hospital you want to go to already acquired the place you quit, and then that may create a negative impression on you because they will have you into the system. So just hold your breath, go in at least through, because I know the probation may be like 3 months, but at least just push on like 5 months and just give an advance notice to quit.
Thank you. Kind of building on that, I know that as new grads, there's often a lot of anxiety, especially in those first 6 months. How did you deal with that new grad anxiety personally, and also with adding COVID for you, Sam, on top of being a new grad? How do you manage that, and so you can stay in the position and not get burnt out so quickly?
That's a great question. And I think it actually links back to what Eddie was saying and what I was thinking of in response to the original question. So, you know, I'm a second career nurse. I've worked a long time throughout my life in different settings. And so one of my focuses, my primary focus actually when finding a job, was the culture of the workplace. I think the nursing basics are going to be the same almost everywhere you go, but the culture of the team that you work with, the hospital that you work in, has a huge impact on that. And so I really picked my place based on that, and that's what has carried me through. They've been very welcoming of new grads. We actually have 3 new grads in my own cohort, one on day, one on evening, and one on night, which is me, and a whole, you know, a group of other new grads. And so there's a lot of support for me on the unit itself, lots of people checking in with me, just looking at my face and on any given shift and saying, how can I help you? What do you need? Can I pass meds for you? And so that's been huge. And I think it links back to the original question about how long should you wait. Is for me, I think at least 6 months. I would say even a year, because you go in with the attitude that you have something to learn from everywhere that you go, but you've also done the legwork beforehand of not just picking any job or just, I know it's hard because we're worried about not getting a job. You know, you go through a lot of interviews and you don't hear back. You put in a lot of applications and you don't hear anything back. But if you end up in a job you don't like, it's kind of like, well, what is it you don't like about it? Is it the commute? Is that something that you know, thought you could compromise on? Is it the people that you're working with? And if it's something like that, like, ask those questions. I asked the question in my interview, what is the culture of this team? Tell me about that. How do people work together? What is the support like? So yeah, that would be my advice on that.
Great. I think that was one of the questions in the chat. How do you find out about the culture if you haven't worked at that location? Carolisa, Eddie, did you ask similar questions in your interviews to find out about the culture?
Yes, I'd say asking. For us at UCSF, you can look up, we have pride values, and we are very big on those. I think just looking at the mission statement of on the website of the organization, I'm sure Eddie can tell you we're very big on those pride values. You know, so I think looking it up and then asking in the interview is what I'd say.
Great. We have another question that's maybe a little more specific, but perhaps you can help. A common prompt in interview questions seems to be, tell us about a quality improvement you have enacted. And as a new grad, I think that's sometimes hard to think about. Did you get asked that question? And if so, do you have some possible suggestions on things that could be thought about when trying to come to an answer for that?
So regarding that question, actually, I think that question is very common. Sometimes it may be direct like that. Sometimes it may not be direct. So when I was interviewing for my second job at my other hospital, actually, I got exactly that question that you have just posed. And I should say, okay, I was fortunate enough because even before I graduated as a nurse, I was already working as a CNA, nursing assistant, for 8 years. So I already had a lot of examples, even though some of them were not directly like to the RN level. It was just on the CNA level. But because I was always involved in different committees, interdisciplinary committees in the different hospitals I was working as a CNA, I was able to come up with an answer on the projects I worked in. But if you don't have, if you just graduated as RN and then they ask you that question and you don't have a quality improvement project that's directly related to nursing, at least just come up with something that is related. I mean, if you worked somewhere, just come up with something that the project that you think you really worked on and because of your input, that project was successful. And if it was about customer service and it was the field you're working in was in retail, translate after giving that example. Don't just leave it there. Just translate it to nursing and say, okay, yes, I know if, for example, I become a team lead, maybe in a nursing project, I'll use the same experience to make sure that we achieve the goals for the project. So it's all about like connecting the dots, even though it may be in a different field, but just conclude by showing how you can use that experience to advance nursing.
Thank you. Dr. JB, you have a question?
I just wanted to add to that. If you were, while at state, if you were active in the NSA, I would imagine that would have provided you with some quality improvement kinds of things that you might have been involved in. So think about what committees you might have been on in the NSA might be helpful as well.
I think any gap that you saw while even in clinicals that you thought you could improve, that could be improved, you can mention that. I think it shows that you're thinking critically. And I know when I came in as a new grad, all our managers were always like, tell us anything we see where we can improve, because you have fresh eyes and ears. So I think even just showing that you notice something, and maybe you could say, I wasn't able to actually, implement this or do anything with it, but I noticed this, and I thought maybe this would be something that I could have, or that could be improved.
Those are all really helpful suggestions. Thank you. Any other questions? Feel free to ask or put it into the chat. I'll give you guys a second. Well, while we're waiting, on the topic of new grad, most of the people here are either just graduated or are going to be graduating soon. What advice do you have, especially since you are all part of new grad residency programs, what advice do you have when it comes to being a great applicant for those programs? They're very competitive, we know. Do you have any advice on how to make yourself stand out, either in the interview process or when you're doing your resume, something to give these people a little leg up?
Oh, I'm already unmuted. Sorry. Actually, I'm going to draw on the advice from my 10-year-old goddaughter, who I was doing interview practice with because I was taking care of her the week that I actually got called for the interview at CPMC. And so I was, I'd given her my list of questions and I was running through them, and she goes, stop, you're too stiff. Just be yourself. Like, because she knows me, she knows my personality. So it's like, I actually reflected on that quite a little bit. And when I went in for the interview, I had done enough practice on my responses to the questions that I had become fluent enough in them that I could then interject part of myself. And so that they could see who I am as a person. And I think I even made some joke about always getting lost in the hospital and needing a map, because like my sense of direction, which has greatly improved since then. But at the end of the interview, one of the panelists was like, oh, and by the way, the elevator is 2 steps down to your, and so I think just like, enough fluidity, you can respond to the questions using critical thinking, but putting yourself out there and who you are, because they want to see unique in who you are as a person.
Yes, so to add on what Sam just said, I think what can really make you stand out from, because it's really so competitive, sometimes you apply and out of the 200 applications, they only need one person for that position. So all of you are going to go in with a good GPA, you have almost the same qualifications, but when it comes to the interview, the GPA may not come out. It's going to be like what Sam said, it's going to be who you are. They are going to be looking at you as an individual, not as what you have on the paper. Do a good job of presenting yourself, because mainly nursing is about like interpersonal relationship with your coworkers, with the entire organization, and most especially with the patients and their families, because it's all about providing patient-centered care. So when they are interviewing you, what I realized was, because my interview was a panel of about 8 people, so I realized the questions, they come from a different angle, but they're asking basically to see how you are going to be able to fit in and how you are going to be able to bring patient satisfaction in that organization. And then moving away from showing your potential, it can also help when you're making your resume. not just mentioning, okay, I did this, I was, for example, I was NSA, but if you, I know we are limited to one page of our resume, but if you put what you did, for example, a job that you did, and then how can you translate that experience to the job you are applying to? I was like, I had a lot of CN experience, so all the CN experience I put on my resume whenever I'm applying, it's really very applicable to the nursing field. But if you are like some of my colleagues who have experience in different fields, like tech or something totally different from nursing, but now you just went through the ERMA, or this is your nursing, like healthcare experience. If you just list what you did as a manager in a certain company, which is not a hospital, it may be, I mean, depends on who is interviewing you, but if there are so many competitive people, if you don't translate what you have on your resume, whatever you did in that company as a manager, to how you are going to use that experience to maybe be a lead in one of the teams in the hospital, it may not be helpful. So just try to find a way to match whatever outside experience you have with how you can bring success to the organization. I think that's really so helpful.
Great, thank you. Dr. Van Dam, did you have a question? I saw you raise your hand.
Not a question, just a comment. You know, I can't go without making a comment. I've had the honor of interviewing many people, students and young faculty, new faculty. And I'm not always looking for nursing knowledge, not looking for that. What I feel like I'm looking for is passion, even if it's naive passion, because the passion's more important. The learning will come, and learning to give perspective will come. It's also a work ethic. If this feels like they are going to, that they give me a line that they're going to uphold every policy, it's like, well, that's nice, but where are you in this? Where's your passion? Where's your work ethic? Do you give a damn? That's what the bottom line for me has always been. Does this person seem like they give a damn? Thanks.
Thank you. I see another question, which is, how far do you think a commute for your first nursing job? What is too far for your commute for your nursing job, in your opinion? Do you guys travel far? Do you have coworkers who travel a really long way? How far away would you be looking?
Depends on your car. What kind? Is it fun? If it's fun to drive, then long commute is fine.
Do you guys have any thoughts on that?
Okay, in terms of commute, okay, I'm lucky that I just got a job like 15 minutes from where I live. But I have coworkers who commute all the way like from Sacramento to come to work. And then I have coworkers who commute from out of state, because like our hospital, we do 12-hour shift. So that means each week you only have to work 3 days. So you can work the week ends on Sunday. So you can work Wednesday, Thursday, Friday, and then for the next week you start Sunday, Monday, Tuesday, and then you fly back to whatever state you come from. So when I talk to these workers to understand why they make this long trip, always flying here to San Francisco to work these few, like to do the shifts and then fly back to the other state, it's all about why you want to do what you are doing, why you like nursing. I think most of us, since we are here, that means all of us love nursing. But on top of that, it's also the organization. If you start working with different organizations, you are going to see a difference. If you end up finding an organization that really, I don't want to use some words, but I should say, if you find an organization that when you work, you feel, okay, this is my home, I can work here for as many years I want to work. So that's what's going to be pushing you. So that's what my colleagues always tell me. So you know what? I like this place, so I can always fly. It's only like 3 days a week, so it's okay. I can always fly here for 4 hours, stay in the hotel, do my shifts, and then go back to my family. And in terms of driving, yes, it's the same thing. People say, yeah, I like here. I know there are some hospitals which are close by, but I have things I consider so important to me in my profession. So since I can get all these things here, I have no problem driving.
So basically, if you find the right fit with an organization, it's worth it, even if it's a longer commute.
I think it's a trade-off, so you decide which one. Yeah.
What's important to you? Yeah. Dr. Van Dam, there's actually a follow-up question to you, which is, do you think passion is more important or past experience when you're, from your perspective, when you're looking at a candidate or if you were hiring a nurse?
Found they usually come together. The past experience that they have, even if it is not as a nurse, makes you who you are because you have incorporated that experience into you, and you're now seeking something that is feeding that same fuel. It's fueling you with that passion that you already have. And so past experience is important, and it doesn't really matter if it's in nursing. When I interview students to come into the School of Nursing, they know nothing about nursing yet, or maybe they've had some experience, but you know, they know what they want. And it's like, why do they know what they want? What's the basis of them knowing what they want? And when you choose a unit to work on, as I was at UCSF that turned into Benioff for 17 years, what kept me there? It was the culture, as Sam was saying. It is very much the culture that you become part of a family, as you feel at home, like Eddie said, and of course, it's the patients as well. What group, as Carolisa said, you know, I'm pediatrics. I wouldn't want to deal with adults other than parents, and that is something that it all fit together. So I'm looking for that passion that they're looking for. My question would be, why do you really want to work here? What are you really looking for? And when they can passionately answer that and not muffle themselves, I think that that's a person that I would want. Also, yeah, well, their past experience will be placed in there. So I think they feed each other. That's the short answer.
That makes sense. Another question here about getting your first job. How hard is it? I know several of you work nights. How hard is it for you to find a new grad job on days? Do you have, you know, past students or classmates that got a job on days? Did you choose nights? Can you talk a little bit about that?
Yeah, so I'm mostly a day shift nurse. I think actually Dr. Van Dam was the manager to my managers on our unit. So I think it depends, it's unit specific. For us, as part of the new grad program, you do get cross-trained on nights. But after that, they kind of let us choose what we wanted. Of course, it depends on the staffing. And I've heard from my coworkers, this changes over the years. Right now, you know, we do need more on nights. So our system is we kind of put in our own schedule. They let us choose, but every now and then, if they need people to do nights, they just move you. So like I just did a week of nights like 2 weeks ago, and I'll do that maybe every 3 months, but that I think is specific to my unit, but I got to choose. I'm mostly a day shift nurse.
Sam, how about you? Did you choose nights or?
I did choose nights, and it's interesting because from the question, I'll answer 2 parts to that question. So I was the manager of the unit, called and said, you know, we really like you. We want to offer you the position. I have something for nights on you on my unit, or I can recommend you for day shift, but I can't guarantee that. So immediately I was like, one, I'm not going to tell this manager who I had a great interview with that I would rather choose something else just because it's nights, which, you know, I did nights for my capstone. It was challenging. I was thinking of, you know, maybe days, but in the end, so yeah, I said, I don't really want to say no to this person who I'm, you know, want to, you know, continue this kind of like developing this professional rapport with. And there was no guarantee that I would actually get that day shift position on the other unit, which ended up being the COVID unit, by the way. And so I kind of chose nights, but I also, you know, when you're doing your capstone, you're doing nights on a capstone, you're doing day shifts, I think with public health, right, it's like level 4. You're doing day classes, you're studying for exams, you've got the NCLEX looming. That's a completely different context than I'm only working nights and I can adapt myself to the schedule. I love nights. I love the night shift crew, and most of the people on the unit have been there for 10, 15, 20 years. And when I asked, like, how could you have worked nights for this many, you know, this many years? They absolutely love it. I don't know if I'll do it for that many years, but there's some benefits. The nighttime salary differential is pretty nice, I have to say. And there's a lot of stuff you don't have to deal with that people on days, gotta give it up to Carolisa, have to deal with. So.
Thank you. Yes, Dr. JV, do you have a question?
And I just wanted to add a comment. 1,000 years ago, when my first job, we rotated a month of days, a month of nights, or a month of days, a month of evenings. But it was all, and I would imagine it probably still is somewhat seniority based. And at the floor that I was on at Stanford, people had been there for a long time, but I was offered a day-night rotation. After a bit of that, I couldn't stand it because it'd be a month of days, a month of nights, and my whole biosystem of sleep, wake, pet got so disjointed. I thought, I can't do this. I can't keep switching shifts because it was my circadian rhythms was So I chose to go on permanent nights. And I did that for about 1.5 years. And then I thought, I'm turning into a zombie. I've got to go back to rotation. But I'll tell you that my choice of going on to nights and staying there as a permanent shift, I had stability as far as my mental and circadian rhythms were going. But I enjoyed the staff on nights far better than the staff on the day shift. And my greatest mentor in nursing was one of the nurses, and Nancy Sengelab Sykes. This is back in 1967, for God's sakes. I will remember that lady till the day I die, because she would just grab, Karen, you're new, you got to, because there were no such things as grad programs or anything. You just graduated from nursing school and you started work. That was it. Boing, you're thrown into the fire. So she just took me by hand and said, here's how you do this. Here's how you do that. And she was I've been blessed to have fantastic mentors throughout my career. So that's a part of it. If you can find a good mentor, be it another nurse or whatever, look for that. And I just wanted to make a comment of, how do you know whether you're going to stay in a unit for any length of time? When you're hired, they invest quite a bit of money into you, into your training, into your orientation, et cetera, where you're not really a full-fledged active nurse for a while. So if you get a job and then turn around 3 months later and say, bye-bye, that's not going to bode well. And as I think Eddie said, you know, the hospital, they all talk to one another, and you don't want to burn your bridges. So be careful about that as well. All right.
I will ditto a little bit of what Karen said there. Nights and days, nights and days. I did 2 weeks, nights, 2 weeks, days, 12 hours. And that just about killed me. I would, thank goodness I was young. I was in the hospital for sick children in Toronto 100 years ago. No, 1,000 like Karen. And it, you know, switching like that was very difficult, and we all had to do it, period. Some of us were, you know, all nauseated at 3 a.m. And you know, even in 2002, when I did night shifts, I still got nauseated at 3 a.m. It was just the way my body is, and I don't do well on nights. The trade-off is that on days, there's a lot of changes, a lot of medical teams running around making changes. Some of these new orders are wrong because they're made by interns. It's like you always have to do more catching and advocating at the nurses station, while on nights you can do more nursing at the bedside if the patient is awake. Now, blessedly, babies and children should sleep through the night. Of course, they're sick and they don't. And then you can attend to the ones who don't. So it's a trade-off of what you need to do. And I think nights can be a kind place to start if you don't get nauseated.
Thank you. There's another question here about, did you have any deal breakers when you were going for your first job? Was there anything that you said, I will not work in a unit that's like X, Y, or Z? And were you able to stick with that? Or was the job hunt so difficult you said, I don't care, I'm just going to take the first thing that gets offered to me because I don't know if something else will come along? Carolisa, do you have any?
Yeah, I'd say it was a little bit of both for me. I'm kind of like Dr. Van Dam, where I didn't really want to work with adults. I'm not going to tell you I didn't apply for jobs with adults. I did. But I think I was kind of like, I knew peds is what I wanted to do. And I think maybe I just got lucky that that's where I ended up. But I definitely had that feeling where I felt like I had to take anything I got. But I also knew what I wanted. So for me, it's a little bit of both. I think it's a personal decision though.
Sam, Eddie, did you have any deal breakers when you were deciding where to work or interviewing?
So after graduating from SF State, when I was looking for my first job as a new grad, I was really open to taking anything, except I was really determined to start in the acute care setting in the hospital. So I was determined to go out of state to get that experience and at least have a foundation before I start going to transitional care settings. So I was lucky that I got a job in the hospital for my first job. But then after my year of experience, I was looking for a second job, and some people say, you know what, you only have 1 year of experience. No one is going to hire. You need at least more experience. I say, you know what, I'm going to apply everywhere. And I really still need a second job. It should be in the hospital. But when I was applying, I was stubborn. I applied everywhere. I didn't care if it's hospital or what. And I used that as as a backup in case, because I set my goal. I said within this time period, I should be having a second job. So I said my goal was 6 months. Once I reached my year of experience, and I had all these interviews, and I had like 3 job offers, but only 1 job was in the hospital. at Kaiser. Others were going to be home health. So I said, you know what? Let me just ask. So I accepted these 2 jobs, but the start date was like 1.5 months later for these ones, as I was waiting on to Kaiser. And then when I received the call back from Kaiser, so I just informed these ones that I'm going to decline the offer. But if I had started the job in the home health, I was going to stay for, like what I mentioned earlier, my plan was to study 6 months as I continue searching for the job I want. But my deal breaker was like, the second job must for sure be in the hospital. Yeah.
Thank you. Any other questions? I know we're approaching 10:30 and Eddie hasn't slept yet. So if there's any other questions, you feel free to speak up or put it in the chat. I know that all of the speakers have offered to share their contact information with everybody, so that if you have follow-up questions or questions specific to their experience or their new grad program, you can feel free to email them and ask them directly. But anything else? Then I think I will pass it back to you, Dr. JB, if you want to do a quick wrap up and thank everybody.
All right, thank you so much, Molly. Thank everybody for all your comments. And I just have to add one thing, just because I can never keep my mouth shut. But as a new grad, Eddie, and you thought about going into home health, boy, that's not one thing that would cross my brain, because as a new grad, I mean, you're graduating with years of nursing experience, limited clinical, really, it's limited. It is what it is, but it's, but you are graduating as a novice at the bedside, and you'll gain rapidly because you're all bright, intelligent, wonderful human beings. But being in a home health thing where you're in the home with person and you have, who's going to help you when you have a question? I want to be in a place where there are other nurses that I can fall back on. I wouldn't want to be independent as a new grad, later on, but not as a new, that's just my thoughts. And I just want to really thank our speakers. You can tell, I mean, one of the wonderful things about San Francisco State is that students, faculty, staff, we are really, I think, a family. We work together well, we feed off of one another, we're all wanting to do the best we can. And it's a wonderful place. So one thing I would say for some of you new grads is think about, as Carolisa has done, coming back and doing, being a clinical faculty member for us as well. That's because we need clinical faculty who are on the front line, who can really tell it like it is. I can tell the history of nursing from the beginning of time, but I myself haven't been at the bedside in a couple of years now, and I can tell that I can tell that. So I think our speakers really shared their hearts, their souls, very interesting information about working in the new world of pandemic and just severe changes in our healthcare system, just as far as no families allowed, except in pediatrics, one parent, and having to deal with death and dying via Zooms and things. It's just, who would have ever thought that we'd be in this kind of a situation? I applaud you for the work you're doing, for the tender, loving care you're giving. And again, I get emotional. I just want to say thank you from the bottom of my heart. So would anybody like to say anything before we?
I have one more thing to say, which Yuli put in the chat, which is if you our recent grad, please join the School of Nursing Alumni Association if you haven't already. We are hoping to do more things like this, hopefully in person someday in the not too distant future, having some networking opportunities, more panels, and working more with the students so that we can do some mentorship programs. So if you are a recent grad, please do that. And if you're soon to be a graduate, think about preparing to do that in May. And if you have questions, you can email Yuli. She put her email there, and I believe she's going to be sending out a recording of this along with the contact information of the speakers, so you can do any of your follow-up questions.
Thank you. And one last thing, part of being in the Alumni Association is to not only network among one another, mentor students, do things like this, do fun things as well. Not that this wasn't fun, but I mean, you know, like dinners and luncheons and things like that. Outings that we have done historically in the past. But I also, part of joining and being part of the Alumni Association is there's an effort to do some fundraising as well. And for, you know, donations, small or large, that help with student scholarships, etc. So think of that as well. Every cent counts. So I want to thank you all, and I wish you a remaining happy New Year. And hands are coming on. I don't know what that means. What is a hand when I see?
They're cheering your comments on.
Oh.
We're clapping for you, Karen. We're clapping, and thanks for everybody. Thanks for the speakers, and thanks for those who joining us today. Thanks, Molly.
Thanks, everyone.
Thank you, everyone.
Nice.
It was marvelous. Thank you.
You all take care.
Have a good day and a happy New Year. Bye-bye.
Thanks, Karen.
Bye-bye.
Bye-bye, all.